Okay, so I thought maybe what we can do before we jump into the whole anatomy side is do a little bit of an introduction, sort of your name, obviously, and just what your background is, why you're coming to this particular workshop, and what you want to be able to get out of it at the end of the day. So, I mean, the nice thing is that there will be just 4 of you in studio, and then Zara's joining tomorrow, Tammy will be catching up. So it gives you guys lots of time to ask questions, to integrate, to review stuff as well, you know, so that we don't have to rush through everything. Okay. Should we start with you, Caitlin?
Yes.
Okay, fab. Let me just turn the camera towards you.
Okay.
All right. Yes.
Camera.
Oh, to us.
Okay, cool. So yeah, I'm Caitlin, and yeah, my yoga journey has been for many years, but I've never taken the plunge into yoga teacher training. Obviously not, because I'm doing it now. But I've done it, you know, when I was in London, I went to different places there. Actually, when I came back from London, I saw the Source Yoga in the old premises, and I instantly felt an urge to come to the studio to do my training, but it wasn't the right time. So anyways, this is a long process. Finally, it's here.
Awesome. Fantastic. And what is your background so far? Have you done anything along the lines of like movement or anything like that? Or what is your career path so far, or your studies or your interests?
Okay. I haven't actually done anything quite physical, like dance or anything with physical movement necessarily. But I did do the yin module.
Yes.
So that's something.
Yeah.
And I'm really interested in, I don't know if it's going to be teaching. I'm going to see how it goes. You know, I might not want to teach, but ideally it would be cool to teach.
Yeah.
I'm really interested in like mind and spirit subjects, and not just about body but mind. It's been for years I've been interested. So yeah, I'll see where this takes me.
See where it leads. Well, put it this way, essentially what it does at the end of the day is just kind of like open up another door.
Yeah.
You know, because I am a big believer in what you'll ultimately get out of this, and I'm sure you actually feel already from yoga, is that whatever's happening on an emotional level, a mental level, a psychological level, manifests physically and vice versa. It's very difficult to separate out all the physical, mental, emotional, spiritual side, because everything is so interwoven. So, having said that, we're talking about anatomy in the human body, but as you know, the physical practice of yoga is actually one small part of it, right? It just happens to be that we're dealing with this vehicle, which is why we need to know how this vehicle actually works. But everything is interwoven. Okay. Awesome, cool. Nice to have you on board. Okay, cool. And are you going to sit in on all the yin again as well?
I don't think so, because I already did it. So I think I might take those weekends as a break.
Absolutely, and continue working on the vinyasa.
Yeah.
Play it by ear, see how it goes. You might feel that you're being best at in one thing back on your weekend. Okay, awesome. Cool. Hey, Kayla.
So my name is Kayla Alves. I'm 23. I'm from Vincent, Namibia. I've been wanting to do yoga or to study yoga for the past couple of years. I started yoga about 5 years ago, and I started yoga more for the emotional, spiritual side of it at the stage of life I was at that time, and also obviously physical. I don't know, I was very sick, and then I started yoga to find a purpose, you know. And I just instantly fell in love, and it's just I knew it was what I wanted to do. And I haven't had the opportunity to study it yet because of what I'm studying at university. So
Okay. So this is actually a little gap that you've got where you can actually grab the time.
I've actually taken a year off to
Fantastic.
specifically just focus on myself. So I feel it's the perfect time to do the course.
Good for you. So being in Windhoek, I know there are quite a few yoga studios in Windhoek. I was really surprised. So who were some of the people?
So I actually started at the Yoga Shala and continued straight through. I still go to classes. And I also do Pilates by Carol.
Yes. Okay.
Yeah.
Say hi to Carol for
I
me.
will.
Okay, cool.
So crazy. Yeah, I did Pilates by Carol for like the past couple of years, and also booty bar. Yeah, and I also did ballet for 12 years.
Okay.
Yeah.
So you're coming definitely from a very physical background.
Yeah,
Okay.
definitely. Yeah.
Okay.
I still have like some injuries and things that I'm like lingering, but yeah.
So lovely to have you here. Thanks for driving all the way down.
Lovely to meet
Okay, yeah. You better send me a message going, I really want to do the course, but I'm driving to the border tomorrow and I'll let you know how it goes.
I wasn't sure if you were like, no,
Yeah,
yeah.
exactly.
I'm studying in Port Elizabeth, and then because of lockdown, like I moved back from PE to back to home,
Right.
and spent like a lot of time with my family last year, and then like this year, and then I decided to just come to Cape Town and do my course. Yeah.
Fantastic. It's awesome having you.
Yeah.
Okay. Great. And how about for you, Stella?
Okay, well, my next I'm 19 years old, and my mom actually got to know that because I've watched her, but I was really not interested just yet. But as I saw her doing it, my mental state and my body was feeling kind of out of place, and I didn't understand what was going on with my mind, and everything was just so in there, like clustered. Because I'm also a dancer, I'm a hip hop dancer and a contemporary dancer. I've been doing that for probably contemporary like 12 years and hip hop about 4. So when I started yoga, which was actually this year, I actually fell in love with it instantly, and it just opened up my eyes to many things and made me realize. And I actually want to incorporate dance and yoga together, because that's why I'm taking the course, because I know my body can do more with the dance as well, and I know yoga can help me with that, expand my abilities with that. So one day I'd like to actually teach yoga and teach hip hop, and open up maybe a studio that focus both, and where people can just come into a space to just calmness, but then also have a fun class and hip hop, and it's still learning.
Fantastic.
Yeah.
Cool. Well, I tell you, because I mean, I danced for many years, and I think I became stronger when I was older because of yoga and Pilates. And if I had that when I was dancing, I think my technique would have been so much improved. And you know, and I think a lot of dancers now are realizing it, and it's that longevity that it creates. And I think it's quite interesting that you're looking for that balance now as well between that physical and maybe getting that mental calm space, because the dance world is tough. It's very, very hectic.
And it's virtue as well also, because it's your time. During that time you can actually look after yourself and work on yourself instead of being a place where people keep you, and it's a lot, and they break you down, and not enough in costing.
Yeah, well, that's it, and that's exactly it. So you know, if you can actually create a healthy mental, emotional space for yourself with yoga, I mean, you're already winning, right? Oh, very cool. Lovely to have all of you. And then we're going to have Zara and Tammy introduce themselves when they come through tomorrow and on Sunday. Okay, so just to give you a little bit of a background for myself as well. Pretty much every single thing that I've done has been revolving around the human body. So, I mean, I just find it fascinating. So I've worked with the human body in a lot of different ways. So I did my degree in dietetics, so clinical nutrition in Vancouver. It was a 4-year degree in science, and I graduated, and I never practiced one day in my life. I just realized I didn't want to actually be in a hospital working with really ill people. I wanted to actually be sort of out there doing something that was a little bit more preventative and healthy living and more about wellness. And the knowledge and understanding it gave me of the human body is fantastic. So I don't regret doing it at all, and I absolutely love university, had a fantastic time. So that was my one little foray into the whole world of the human body. And I also used to dance as well, so I understand coming from that background and how we can be tempted to push our bodies, the injuries that happen, And then I started exploring Pilates. I started doing Pilates with someone in Vancouver who worked with the dance company that I was with at the time. And she was amazing. And that was my first taste of Pilates. And then I went down the whole Pilates route. So that's, you can see why there's like a big Pilates studio there. And it's incredible for rehabilitation. And it's not just for dancers. We have a few clients that are in their 80s. We have kids that come to us, and it's this huge range of people, which is amazing. And then when Brian and I opened up the Source, which you went to, you guys never saw the old studio, but the Source is now here. We have this amazing space that we could open a yoga studio, and that has always been Ryan's passion, you know. So he's going to be teaching you guys yogic philosophy and transformation on this course. That's what he does. And so we opened up yoga, and so I thought, great, well, I better learn how to teach yoga, because you can't own a yoga studio and not know how to teach. Fell in love with it. There's a whole dimension that I've brought from the yoga into my teaching. So it's the mindfulness, it's the breath, it's the flow, it's the little pause moments in between. So, you know, my whole style of teaching has changed, and it's fusing together. And then on top of that, I've done other modalities, something called gyrokinesis and gyrotonic, which is all kinds of rotational and spiraling movements, which are absolutely beautifully complemented to both Pilates and yoga. So there's just another dynamic that's added there as well. And then most recently, I've become very interested in fascia. So we're going to talk a little bit about fascia now. It's like one of the big buzzwords in the movement and the wellness industry at the moment. So we're going to review what that is. And so I bring a lot of that in. So when I teach an anatomy course, I'm not coming at it just like, okay, you guys are going to do yoga. This is what we're doing. You guys are going to Pilates. This is what we're doing. It really is a holistic view of how the body moves and operates, and more importantly, how we can actually make it work for each individual. So that when you guys go into your course now with Bianca, with Carrie, and you're breaking down one of the postures, like Trikonasana maybe, the triangle pose, you can actually go, this is what I'm feeling, this is why I'm feeling it, this doesn't feel so good at my knee joint, why is that, and how can I actually make it work for me? That's, at the end of the day, what I'd like you guys to be able to get out of the anatomy side, as opposed to me feeding you a whole bunch of information that you feel like you've got to memorize. I want you to be able to take this information and apply it to what you're doing in the course. So if you guys have questions, perfect opportunity to ask as well. Okay, sound like a plan?
Sure.
Fantastic. Okay, so I did email you guys a little PDF file for the anatomy. If you have it on your device, if you printed it out, you're welcome to refer to it. But what I'm also going to do is open it up on the laptop as a PDF so that we can refer to it as we go through. You'll be able to review it on the screen, okay? And then I wanted more to be about us having a discussion and taking a look at the skeleton, look at the muscles, and figuring out how it all works. All right, okay. So guys, the other thing is, by the way, if you need water, you know that there's water around the corner. We're going to take a break in a few minutes as well, so that I'll show you where the tea and coffees are. There are so many different books and resources that you guys can refer to. So I keep these at the studio. At any point, if you're here, if you're having a little bit of a break in between class, or you've arrived early, or you're staying late, you're more than welcome to read through them, but I prefer that they don't leave the studio. So it's taking me a long time to collect these books. There are also fantastic resources online. I mean, I think I'm not going to say very few people, but it's almost less common now to go into a bookshop and actually buy a hard copy book. So many people are ordering online. So you can take a look online, and there are also some fantastic apps that you can put onto your devices as well that give you all kinds of information about the human body. So you can check those out as we go. So I'm going to leave these here today, and then as we go through the muscles today and tomorrow, if you want to use one of these to refer to, you're very welcome to. So, let me just show this to the screen. This is called Anatomy of Movement, and it is by Blandine Calais-Germain. She's French. This book was originally written in French, but it is such a fantastic book. It ended up being translated into lots of different languages. So I've got an English copy here. And then this and this. This one is called Pilates Anatomy. This one is called Yoga Anatomy. And these two people, Ray Zakovitz and Karen Clippinger, are the two people that I trained with in California. Their wealth of knowledge is unbelievable. And what they've done is they've taken specific Pilates exercises and highlighted the muscles that are working. And it's exactly the same in this Yoga Anatomy book. So these are fantastic because it's very posture specific, which is great. So if you want to check those out. This is actually the same book. So this is called The Concise Book of Muscles. So I ordered these on Takealot. This, the light green one, is the 3rd edition. Okay, so if somebody wants to use that today to refer to it, you're more than welcome to. And this is the 4th edition. I'm going to be holding on to this while we're talking because this is the latest one. They might have a 5th edition. I haven't actually had a look. This is an amazing book. I think they've just done such a fantastic job. The diagrams are incredibly clear. And then also what they did in the back of this one, which I've actually ripped out, is they put in an anatomy chart. So you see those charts that are up on the wall at the back? Yeah. Okay, it's that. So it's nice to have just that whole picture there as well. So at any point, I think if you're going to order a book, I would do this one, The Concise Book of Muscles. All right. So we're going to talk about these a little bit later when we get to our section on fascia. All right, so let me just open up my little presentation here, do a little screen share for you guys. I just have to make this full size. There we go. All right, so this is an introduction to anatomy, and more importantly, it's about how we apply anatomy to our movement. So basically, anatomy comes from ancient Greek. So ana meaning up and toma meaning cutting. So it's basically the cutting up, all right? So they learned most of their information back then about dissecting cadavers, right? Taking a dead body, cutting it open, seeing what's underneath the skin, seeing where the different bones are, what sort of muscles are connected where, how did the joints move. That's how we got most of our information. So when we're talking about anatomy now, we are very specifically referring to human anatomy, all right? Because we're going to be dealing with the human body. Obviously, if you're studying to become a vet, you're going to be doing something a little bit different, right? So let me just take us back here. All right, so we have several different systems of the body. All right, so, my goodness, let me just hold on there. All right, so let me just do this little screen share again here. There we go, much better. See, and then my little tabs in the corner so I can see. Okay, fantastic. So just a quick little recap there, just in case it wasn't on here, is that we were speaking about the nervous system, central nervous system, peripheral nervous system. That's going to be the brain, the spinal cord, and then through the nerves that lead all the way to the fingertips and toes. And then with our central nervous system, just talking about the brain itself and how we have that little central point, which is our lizard brain, survival, and then we have all the other layers that are over top of it. And now we're going to talk about the 4 different lobes of the brain. So the very first one, and you guys will be able to see this when I send this recording to you, it's this front lobe right here, which is almost like a bluey purple color, but basically it's at the very front of the brain right here. So if you took a look at our skeleton, it's going to be this front section right here. That is the frontal lobe, all right? And that area is responsible for motor skills. It's responsible for language and cognition. And it's also for expressive language. So, you know, if somebody has a car accident and slam on the brakes and then they suddenly bang that section of their head, if there's any kind of damage to that frontal lobe, those are the specific skills that are actually going to be affected through that injury. So they might have a difficult time kind of remembering language or imagery. They might have difficulty with some of their motor skills as well. Okay, and again, some people that maybe have a stroke and have a blood clot in that area, it's going to affect those skills as well. Yeah. And then the next section, so let me just hit screen share again, is just on top. And this is the yellow section, if you guys can see it from here, and it is called the parietal lobe. So this is responsible for any kind of tactile information. So it's anything that's pressure, touch, anything that's sensitive to that. So again, if somebody has any kind of injury on that top area, those are going to be the skills that are going to be affected. Yeah? And then along the side of the head, on either side, so that is called the temporal lobe on either side. So on our little diagram, if I do a screen share, I believe it's actually in pink. And the temporal lobe right here is responsible for sounds and language that we hear, which actually makes a lot of sense when you think about it, because where are our ears? Yeah? So the ears are basically situated on either side. So basically all the information that we capture and then it's fed into that temporal lobe. So again, any kind of damage to the side of the head could very well affect the sounds that we hear or don't hear and how we are able to interpret them, right? There's also this tiny little point inside the temporal lobe called the hippocampus. Have you guys heard of it? Yeah, it's kind of a strange name, right? So the hippocampus is responsible for forming memories. And it's quite interesting that some people are born with a very large hippocampus. And their ability to remember information is phenomenal. You know? Unfortunately, we can train our brains in a certain way to maximize our memory and our retention of information, but we can never grow our hippocampus. Not like you can actually build your bicep, right? You can't actually build your hippocampus. So there was a study done years and years ago with taxi cab drivers in London. You've been to London? You guys ever been to London? It's like a maze. It's huge. There are one-way streets. There are dead ends. It's crazy. And yeah, so can you imagine before the days of Google, right? Because now I just actually open up Google Maps and let it guide me wherever I need to go. In the days before that, you had to pass this test to become a taxi cab driver, and very few people could pass. Because you need to know that whole city inside out and backwards to know where you're taking your fare. And when they studied the guys that actually passed, all of them had larger than average hippocampuses. I think is the plural. Yeah, fascinating. Okay? So they have this ability to be able to form those memories and remember where they're going. Okay. Yeah. All right, and now we've got one little section of the brain left, and at the back, and it's green on here, is called the occipital lobe. And that occipital lobe
is actually responsible for visual stimuli and information.
So now that sounds a little bit weird because you're thinking, well, my eyeballs are at the front here. Why is like all of that visual stuff? But think about where your optic nerve runs. Yeah? So your eyeballs are at the front, but the nerves actually travel backwards. So it's one of those things where if you have a hard enough fall backwards and you bang the back of your head, it's like you actually almost like see black or you see stars, right? And that's one of the reasons is it actually has this impact, the shock into the eyes as well. So that is the occipital lobe. And in fact, if you take your hands right now and you put your fingers just at the base of your skull, can you feel that you've got almost two little knobs on either side? Those are actually called the occipital bones. And we oftentimes use them as landmarks when we talk to people about lengthen up through the back of the neck, feel the occipital bones lift, or can you tilt them backwards and forwards? So we can use them as landmarks when we're watching how people are moving as well, or giving them a spot to identify, right? Okay. So those are the four lobes. However, if we go back onto our little screen share right here, you'll see down at the bottom that there is an orange area, and it is called the cerebellum, which leads into the brain stem. All right? So it's not officially one of the lobes, but basically the cerebellum is responsible for all kinds of voluntary things like our posture, our movements, our speech, whereas the brain stem, which is below it, actually controls a flow of messages between the brain and the body. And these are sort of basic functions that we don't even think about, like breathing. So we've been sitting here for about an hour. Have you guys been thinking about breathing? Have you been thinking about your blood pressure? Like, have you been controlling your blood pressure in any way? All of that is actually controlled and guided by the brainstem. So again, if somebody has quite a serious accident to either one of those areas, it's going to affect those basic functions. Yeah? Okay. Any questions so far? All good. Fantastic. I know sometimes it can be a lot of info to take in. It is fascinating, hey?
Yeah, that's very interesting. And one little body can do so much.
I know, that's exactly it. All right, so the next little slide here is talking about something called the meninges. Have you guys heard of meningitis?
Yes.
Okay, so basically any itis talks about an inflammation of something. Tendinitis is an inflammation at tendons, right? Okay, meningitis is an inflammation of these meninges. And the meninges are membrane layers that cover the brain and the spinal cord, which are, of course, our central nervous system. All right? So we have three different layers, okay? So we've got the skin on top, our scalp, okay? Then underneath that, we have what's called the periosteum. It's like this thin sheath. And then we have the bone. We have our skull. And then we have the meninges. We have the dura mater, we have the arachnoid mater, and we have the pia mater. So all three layers run over the brain and all the way down the spinal column. And their job is to create a sealed, sterile environment, which is the problem when an infection gets in and you get something like meningitis, all right? And that is going to cause inflammation. It's an infection, basically, yeah? So along with creating a sealed environment, it's also for a little bit of cushioning. I mean, the number of times that you think, oh, I hit my head on something, you know, or you take a look at a 2-year-old falling down as they're learning how to walk, and you think, oh, the number of head bumps. The fact fact is they haven't rattled their head inside their skull because they have the meninges and some fluid around there that basically creating almost like a cushioned environment for them as well. Okay, so that is the meninges that wraps all the way around the central nervous system. Yeah, great. All right, now from here, we're going to talk a little bit about the spinal cord, okay? So the spinal cord actually goes from the skull, the base of the skull. So remember here, we've got the 4 lobes. I just want to see that it's in there. We've got the 4 lobes here. We've got the cerebellum inside the skull at the back. And then we've got the brain stem, which controls those basic functions. And then it becomes the spinal cord, which lives inside this column right here. All of these vertebrae put together. And in the middle, there's a hole so that the spinal cord can live in there, and it's pretty well protected. I mean, you'd have to actually have a serious accident or a very unlucky accident to damage your spinal cord. Yeah, it does happen, as I'm sure we've all heard. All right, it does happen, but as a whole, it's pretty well protected in there. So it goes all the way from the very top, it comes all the way down, but as it comes to this lower section of the spine, it is no longer a thick rope. It actually spreads into these sort of feathery bits, and it's called the horse's tail. So if you imagine what a horse's tail looks like, so in Latin, it's cauda equina, okay? And that is the lower end of your spinal column. So this is a thick rope up here, and then it goes all feathery at the bottom. So I don't know if you guys have ever had like an epidural. Okay, I had an epidural when I had Ella. And then what they do is that they very carefully will actually give you an injection into your lower back because they don't want to penetrate through the meninges and into the central nervous system. And so this is one of the best places to it because it's all feathered out and you can kind of wiggle the needle between all of it as well. As opposed to up here, you might have a chance of sort of puncturing, right? Okay. So brain plus the spinal cord is going to make up your central nervous system. Okay. And then we're going to talk a little bit about our peripheral nervous system here. Okay, so the peripheral nervous system has 31 pairs of nerves. And we talk about pairs of nerves because remember I told you, or I showed you, that there's a hole on the left and there's a hole on the right. Yeah, so we have a nerve on each side. So this is 1 pair, this is 2 pairs, 3 pairs, blah, 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 all the way up. And then there's also nerves right up to the top here and also nerves right down to the bottom here. So those nerves feed throughout the whole body. It's set up pretty logically. All of these nerves around the neck are going to actually feed into areas like the neck, the shoulders, and the arms. So if somebody comes to me and said, oh, I've been getting all of these like pins and needles or these numb feelings in my hands. Now, I'm not about to treat them. I'm not a doctor and I'm not a physio. But in the back of my head, I've got that knowledge of going, okay, so all the nerves that actually feed your arms come from here. And then I can say to them, well, did something happen to your neck? Did you sleep funny? Did you bang it? I've been doing lots and lots of headstands, okay? You know? So actually just finding out, well, what is going on? And then
kind of know, okay, let's avoid this completely, or let's refer them on to somebody else who can actually treat them, right? So doesn't that make sense that this area is going to feed the upper part? And then we have a whole bunch of nerves around this sort of mid-back area, and they are then going to start feeding all the way around this midsection, all the way around the chest, all the way around the abs, the core, yeah? And then we have nerves in the lower back and around the sacrum, and those operate the pelvis and the legs, everything that's down, okay? So we'll talk about it a little bit tomorrow, because tomorrow we'll be talking a little bit more about the muscles. Have you guys heard of the sciatic nerve? Okay, so it's not actually just a single nerve. It's a whole bundle of nerves called the sciatic nerve. It is the longest nerve connection in the body. And basically, it comes from the lumbar spine area, runs through the pelvis, down the leg, past the knee, down the lower limb, and it runs into the foot. So sometimes people might have an injury around the lower back, or there's a very specific little bum muscle that we're going to talk about tomorrow that can get really tight on some people, and it pinches the sciatic nerve. And this person's now suddenly getting pins and needles and shooting pains into their foot. So you're kind of thinking, now again, I'm not a physio, I'm not a doctor, I'm not diagnosing anything. But in the back of my head, I'm kind of thinking, okay, well, did you sprain your ankle? No? Okay, that's fine. Okay, well, that wouldn't explain it. What's happening with knees? Okay, oh yes, I actually really tweaked my back the other day. All right, and it could actually give you that information where you're going, okay, there's something happening at the lower back here that's affecting that sciatic nerve. That's part of the peripheral nervous system, right? And let's refer them on to someone. Right. Yeah, and so, I mean, you get a lot of information if you just actually start to get that basic understanding of how the human body operates. Okay.
Who would you, who would you refer someone, like, who would you refer the person to?
Yeah.
I'm just curious, like,
Yeah.
who fix that or help?
Yeah.
That, like,
You know, so a lot of people actually do have somebody that they already go to. So whether or not it's a chiropractor, an osteopath, a physio, an acupuncturist,
because the options.
they have their options. If there's nobody that they have a connection to, I would probably send them to a physiotherapist. Okay. Yeah. And then they may very well refer them on to someone else. But that's who I would instinctively send them to.
Okay.
Yeah. Okay.
I actually got something to say about, because I actually feel a lot of pain by the tail. And it's very hard for me to sit on my bum sometimes, even on hard. Like
Yes.
this is fine, but certain exercises, like for example, like this,
Yes.
it will hurt from my tail. It's very.
Has it always been like that?
like this? Like,
Yeah.
probably like 2 years.
And did you have some kind of bang or trauma or fall?
I don't remember. I don't fall much.
Okay.
I usually fall my foot.
Yeah,
my
yeah,
ankle,
yeah.
But I don't fall anywhere.
Mm.
Doesn't hurt.
So again, it's quite interesting that, okay, so years ago, and I'm talking about, so I grew up in Canada, and we grew up in a little logging town with amazing snowfall in winter time. And then we used to take our toboggans. You know what a toboggan is? Like a wooden sled, right? Okay. We used to take our toboggans and we used to hike up the logging trails, and then we'd do these incredible ramps to go flying, and then we'd all take turns like, and I landed on my coccyx, on my tailbone so hard I could barely walk home. And then it was really, really sore, and then it was always kind of like a little bit sore to the touch or when I sat down. And about 10 years later, it felt okay. 10 years, where I was just like, because there's nothing they can do. There's nothing they can actually do there. However, there are some people that have their tailbone, instead of curling under
that it sticks out a little bit. And I've got a few of those clients that when we do like a seated position, and then I say to them, let's roll back, they're like, oh, and we've got to put like an extra pad, or literally I'll see them kind of avoid their tailbone and roll like this, and it's because their tailbone fits out the opposite way. And again, I think the only way you'd be able to tell if that's the issue for you is if you had some kind of x-ray, or if you actually went and saw someone who could actually palpate it and feel what's
Because
going
even
on.
that meaning that what you did, I can't remember.
Yeah, so I wonder if that's what's,
Yeah,
so,
you look to it. Make it to feel.
see, I've never actually palpated it on someone else because again, it's not really my job. It's a lawsuit waiting to happen.
Give it to yourself.
Yeah.
When I feel it and touch it, it feels like a bruise.
And does it feel like it's actually sticking out this way a bit?
It feels like it's going in, but I still can't do certain moves. So
Yeah.
I don't know. It's just been.
Yeah, well, put it this way, if it's something that continues to aggravate you, I would definitely, I mean, you're too young to have, like, a massive injury, you know what I mean? So if it's something that's still, like, bugging you in a while, I would probably just go and have it checked out.
I just wanted to ask,
Mm.
maybe it's not way connected. I don't know.
Yeah. No, unless it was, like, some kind of obvious injury. I don't think so.
I don't think anything else. I only tore my ligament twice.
Only.
Only, that's about it.
Yeah, I don't think that would actually connect or affect the coccyx. All right, guys, so any questions so far on our 11/12, if we include fascia, the 11 systems of the body, and what we've spoken about in a little bit of depth right now is the nervous system, which is one of those systems, which is made up of the central nervous system and the peripheral nervous system, and the two of those together are one continuous unit that sends signals to your body and takes messages back to the brain. It's a non-stop loop that goes around. Yeah? All good? Fantastic. Okay, if anything comes up, you're just going to give me a shout so that we can stop and review. All right, so we're going to start talking a little bit about anatomical directions, and I'm just going to actually open up my book so that I can show you. Let me just find the right page. All right, so these anatomical directions, we often just use them when we are talking to clients, okay, about how they're standing. Sometimes they come across a little bit clinical. So in a yoga class, there's certain words that I would use and that I wouldn't use. This is good for you guys as teachers to understand. It's not necessarily the words that you would use with clients, okay, but it is good that you understand what they are. All right. So the first thing we're going to talk about, and in this particular book, it's on page 9, if you've got the 4th edition, and this is anatomical position. So any movement of the body that we make, we refer to from this position here, where my toes are pointing forward, you're looking at me from the front, this is the anterior view is the front, and the palms of my hands are facing forward. So this is our reference point. This is a starting position for any movement that we're going to talk about in the course. So this is anterior. Does anybody want to guess what the back side of the body is called?
Posterior.
Yes, good. So we've got anterior is the front and posterior is the back body, okay? In yoga, we oftentimes talk about the front body and the back body. Same thing, anterior and posterior of the back. All right. So those are the two starting views that we talk about. And then, if we talk about something moving upwards on the body, or something that's a little bit more towards the head or the upper body, we call that superior. And if it's heading downwards towards your feet, okay, it is called inferior. So we've got superior and we've got inferior. Yeah, pretty common sense really when you think about it. If you've got something that is towards the middle of the body or towards the midline of the body, we call it medial. And if it's moving away from that midline towards the sides, we would call it lateral. So we've got medial towards the middle and lateral towards the side. So for example, if you've got your hands around your ribs and you're breathing laterally, the ribs are expanding sideways, right? And then drawing them in again. So you've got medial and you've got lateral there. Does that make sense? Fantastic. Very common sense, right? All right, now there are two terms that I don't use very commonly, but it's good for you to know what they are, and that is proximal and distal, okay? So if something is close, you say it's in proximity, right? So proximal basically means that it's close to the body, it's close to the root of the limb. And if something's far away, it's a long distance away, we could say that it's distal, okay? So that would be now further away from your body, further away from the root of the limb. So we have proximal and we have distal. I don't use them very often, but it's good for you to know what they are, okay? Something we do talk about a lot is deep and superficial, okay? So if something is deep, and specifically talking about muscles, if something is deep, it's close to the joint, it's close to the bone. So we have a lot of deep muscles, and just to confuse you, we sometimes call them intrinsic. So deep and intrinsic are kind of interchangeable, right? Okay? And for example, around the shoulder joint, we have deep muscles called the rotator cuff. Yeah? And then we have more superficial muscles, the ones that are more under the skin directly. They're a little bit more visible if somebody has very developed muscles. And so we call those superficial, or to confuse you, we can call them global. So superficial and global muscles would be the same thing. And if we talk about the shoulder again, we can talk about the deltoid, right? The deltoid is that big muscle that goes over the shoulder that you see on some athletes, like basketball players, are very developed, right? Because of all the overhead movements that they'll actually do. So those would be more of the superficial muscles. Okay, so we'll have deep and we'll have superficial. Make sense?
Yes.
Fabulous. And then some very specific terminology for the hands and feet. So have you guys heard of dolphins having a dorsal fin? Yeah, okay. Exactly. So a dorsal fin basically means the fins on the back. All right. So when we talk about something being dorsal, we're talking about it being on the back. This is the dorsal part of my hand. This is the dorsal part of my feet. Okay? If I was to flip my hands over, this is called palmar, like the palm of your hand, palmar. Okay? And very specifically, if you looked underneath my foot, hopefully it's not too dirty. Have a quick look. If you look at the bottom of my foot, that is called plantar. Palmar on your hands, plantar on your foot. Have you guys heard of plantar warts? So you can get warts on the bottom of your foot, and they're called plantar warts or verrucas. Okay? So plantar warts on the bottom of your foot, that's on the plantar side. When we talk about fascia, we talk about plantar fasciitis. Okay? Does all of that make sense? You guys all seem pretty comfortable with all of those definitions, okay? Okay. Are you happy to keep going for a few minutes, or do you need a break? Should we do another 10 minutes? Then we'll take a quick break? Fantastic. All right. So we're going to start talking about different ways that our body can move. And there are 3 different directions that we can move. When you guys take a look at this video later, you can see it quite clearly here that the pink one here is called the sagittal plane, the green one is called the horizontal, and the blue one is called the frontal plane. So let's just break those down in a little bit more detail so that you understand what they are. So we can move our bodies in lots of different directions, right? And we can move them around different joints. So one of the ways that we can move our body is, this is anatomical position, right? We can move forwards and backwards. Yeah? We can move forwards and backwards. We can move backwards and forwards. We can move forwards and backwards. So I did all those movements around different joints, and you heard me saying forwards and backwards, right? So if I took a piece of paper or a sheet of glass, or however you want to think about it, if I put it this way through my body, through the middle of my body, and I popped out the back like that, okay? That is called the sagittal plane. And it divides me into right and left portions. Now, I'm not saying right and left halves, because I could move the book this way, and it's still the sagittal plane, but it's not even. It's right and left portions. And when I move in the same direction as the plane, it's forward and back. It is forward and back. We could say it is flexion and extension. 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 Okay? So flexion and extension take place in this plane. Okay, so just off the top of your head, what are some movements that you know that go forwards and backwards?
Well, in yoga or just in general?
In general, if it's yoga, great. In general, what goes forward and backwards?
Of the body. Well, isn't the yoga, you keep the breath, and then you can just
Yes.
Yeah.
Absolutely. As a matter of fact, it's called a forward fold, right? Forward fold. That is in the sagittal plane. Fabulous. What else?
Doing like bicycle.
Absolutely. Take some dumbbells. You're bending at the elbow, forward and backwards. That is in the sagittal plane. Awesome. Anything else? Absolutely. So you can bring your leg up and down. And in dancing, it could be like a grand battement to the front, right? Okay. So that would be forward and backwards in the sagittal plane. Awesome. Okay. Makes sense. We're applying the understanding of planes of movement into actual exercises that we know. It doesn't have to be this theoretical thing, okay? So now we have another plane that actually looks like this. It goes through the side of the body, it goes all the way through the middle of me, even or not, comes out the other side like this. And it is called the frontal plane, or they love to confuse you, they can call it the coronal plane too. So the coronal plane and the frontal plane are exactly the same thing, okay? Basically what it does is it divides you into front and back portions, even or not, okay? Anterior, posterior portions. So the movements that can happen in that plane might look like this. Out and in. Out and in. Out and in. I'm doing different joints now. Out and in. Perhaps I should call it something a little bit more fancy. Maybe we should call it abduction. Adduction. Abduction. Adduction. I could maybe do this with my spine, where I do a side bend, which is called lateral side flexion. All of that is taking place in the frontal plane or the coronal plane. Make sense? Fantastic. Tell me some movements that you know that happen in the coronal plane.
Well, I know how to do this.
Would you be standing or lying on your side?
Well, you can be standing, but the majority be standing.
Fantastic. Good. So like legs to the side. There's one that we do in Pilates a lot where you lie on your side and you lift your leg up. Good.
I was gonna say, like a snow angel.
Oh, what does that look like?
It's just like in the snow, we just
Yes, absolutely. So if you're lying on your back, you open your arms, open your legs, make a snow angel. Fantastic. That is everything moving in the coronal plane.
Except is that the horizontal? No, because you lie on your back.
No. Doesn't matter which way you're standing, it's still out and in, right?
Fair enough,
Okay.
How about like a
Yeah, fantastic. So the first thing is the leader, adduction, and then over you go. Fantastic. Okay, nice. So you're starting to apply that to the movements that you know. Okay, now there is one more plane, and it looks like this. It basically sticks out like a tutu, okay, of a ballerina's outfit. And it's going to cut us into lower and upper portions. And again, it doesn't have to be even. It could be anywhere along here. And this is called the horizontal plane, which is actually quite easy to remember because it looks like the horizon. Okay? Or some people call it the transverse plane. So it's the horizontal or the transverse plane. And the movements that take place here are any kind of twisting or rotational movements. So the most obvious thing that we can twist and rotate would be the spine, yeah? But there are a couple of other things that we can twist and rotate. Hip joint maybe, yeah? Shoulder joints. We can do that twisting and rotating at the shoulder joints as well.
And what about your head?
Yes, well, that's part of your spine. Absolutely. That is the very top area of your spine is called the cervical spine. Fantastic. Good. So again, give me some ideas of movements that involve twisting and rotating.
Yeah, that's
Absolutely. Any kind of seated spine twist right there. Fantastic. Good.
There?
And I was like, my spine, don't you do this?
Yeah.
Especially when you sit in for yoga, you do.
Yes, absolutely good. So that's that whole rotation of the spine going in both directions. Awesome. Any ideas?
Screwing the light bulb.
Absolutely. Absolutely. So that will be
Or like
okay now.
Johnson.
Yeah, exactly. Exactly. So now I've got to say that that's quite an interesting one because if you're actually screwing in a light bulb, that is a very specific movement that happens at the forearm that's called pronation and supination. So it's a little bit more at the shoulder joint. So if it's a light bulb way up there, then you might actually get the rotation from the shoulder. But if it's a tiny little light bulb, then it would be coming from the forearm, which is a slightly different movement. Yeah, but it's quite unique, and we're going to talk about it in a few seconds.
Okay.
Okay, awesome. Good. Okay, guys, please come up into standing. All right, so just make sure you've got a little bit of space. You guys have been sitting for so long. Please could you show me anatomical position? What is your reference point for all these movements? So standing with the palms of your hands facing forward. Could you please flex your spine? Flex your spine. Okay, so first of all, identify where's your spine. Yes, good. So we know what the spine is. If we flex the spine, we round. Yes, good. Could you please come back to anatomical position? Now, could you please extend your spine? Yes, so flexion and extension are the two opposite directions and come back to a neutral position. Could you please flex both your elbows? It's like a biceps curl. Good. And could you please extend both your elbows? Nicely done. Could you please flex your left shoulder? Okay, now that's taking it away. So flexion and extension is forwards and backwards. Exactly. Because you guys are thinking I'm moving my hand forward, but in fact, where did the movement come from? The shoulder joint, right? So now show me flexing the right shoulder. Fabulous. Now, could you extend the right shoulder? Very nice. So now, yeah, so if you take it out to the side, it's a slightly different movement. Forwards and backwards. That's extension. You've got it. Come back to anatomical position. Could you please flex your right hip? So whether or not you decide to keep your legs straight or bent doesn't matter. You are bending the right hip, right? That's flexion. Go back to anatomical position. Could you please flex your left hip? Nice. Place it down. Could you please extend your right hip? You could. So you're holding onto the foot. So you're bending the knee as well. And as long as you bring the thigh backwards, that's extension. How about if you don't use your hand to help you? Yeah, there you go. Now, whether or not you bend the leg or straighten it, doesn't matter. You are moving the hip joints that way. Fantastic. Guys, I was saying flexion and extension. Anytime you hear the words flexion and extension, we are moving forwards and backwards in the sagittal plane. That's one of the ways that we go, right? Okay, come back to anatomical position. Could you please abduct both arms? Yes. Good. So abduct means you take something away. Yes, abduct at the shoulders. Exactly. Come back again. Could you please abduct your right hip? Yes. You take the leg to the side. Come back to anatomical position. Could you please
abduct your right shoulder and left hip at the same time.
And
Yes! So,
coordination.
yeah, right shoulder, left hip.
Okay.
Yes! Good. So it's a little bit of brain gym, okay? Calm down. Could you please laterally flex your spine? I don't care which way you go. Laterally, what does lateral mean? Sideways.
Okay. So
That's right. Yes, good. So lateral means to the side, and flexing means a bending action. And then try the other way just so you stay nice and even. Oh, doesn't that feel good? And then come back to the center. Fantastic. Now, could you please externally rotate both your hips? Yes, good.
yeah.
Basically, this is like how ballerinas stand. External hip rotation, whether or not your legs are together or apart, it's external rotation. How about some internal rotation at both hips? Very nice. Good. And come back to anatomical position. Could you please rotate your spine? Rotate your spine. Yes. Any kind of twisting action of the spine is rotation of the spine. Could you please internally rotate your right shoulder? Could you please externally rotate your left shoulder?
Yeah.
Very good. And then come back to center. Nicely done. Now, I want you to please turn sideways and face towards these windows. You're going to stand up towards that far end of your mats. That's it. Show me anatomical position. Could you please abduct your left hip and step to the side? Yes, good. Could you please abduct both shoulders and hold? Good. Could you please externally rotate your left hip? Okay, so that was all your right hip, guys. Okay, that's it. Fantastic. Could you please flex your left hip and lean towards me? Nice. Good, good, good. Now, could you please extend and straighten your left knee? Could you please abduct your left shoulder and bring your hand towards your leg? Could you please rotate your cervical spine to look up? And voila, you guys are in triangle pose.
Yeah.
Yes? And then make your way out of it. Step all the way back. So guys, I did that. You can come and grab a seat. I did that at the end just to highlight that we can talk about all of these movements very simplistically. There are very few movements that we do that aren't complex. Our bodies are designed to move around all our joints in their particular range of movements in different ways at different times. And that's the beautiful thing about yoga, is you can take your body into all these different postures, right? Is that starting to make sense?
Some nice cracks in my back.
Oh yeah, I always feel that as soon as I do that triangle, my inner thigh goes. Exactly. All right. So we incorporated all three planes of movement, getting into triangle around different joints of the body. Okay. I would be highly surprised if I ever walked into a yoga class and a yoga teacher cued getting into triangle pose like that. Yeah? No teacher is going to talk about abduct their hip, laterally flex, you know. So because a lot of clients don't know that. This is taking your level of knowledge to a different level of how you would be teaching it to clients. This is for your understanding of how the human body is moving as we get in and out of different poses. Okay, awesome. So guys, it is 20 to 7. Shall we take a 5-minute break and then we'll come back? Awesome. Let me just pause the recording. Okay, so we're just going to go into a little bit of details about the skeleton and take a look at bones themselves. Okay, so we spoke about our joint movements already. We spoke about the joints 2 seconds ago, and we all went through the various movements. And there are some major bones on the body that I want you guys to just be familiar with, so that when you hear them referred to, that it doesn't sound like a foreign language. All right. So if we take a look, starting at the very top at the head. So this is the skull, oftentimes called the cranium. Yeah. And these are our facial bones. And again, if you wanted to go into huge detail, there would be different names for all the different bones on the face. This jawbone right here actually has a very specific name. It's called the mandible. Okay, so that is your jawbone, is the mandible right here. And then you can't really see it from where you guys are, but inside, behind the jaw, it's in line with sort of the middle of your neck, is another bone called the hyoid bone. It's H-Y-O-I-D. It's a floating bone, and it's there to actually help us speak, to swallow, okay? Works just inside the neck. And then we have some very specific little points on the skull. These little bones right here. So if you put your hand on yourself, just behind your ears, can you feel that there's 2 little sharp bones there? Those are these bones here. That is called the mastoid process. We've got one on the left and we've got one on the right. Guys, anytime you hear the word process, you just have to know that it's a place where a muscle attaches. So this is the mastoid process. There is going to be a muscle or more than one muscle that attaches to that point. Okay? And then we spoke about the occipital bones earlier. Those 2 little bones at the back of your skull that are right here. And oftentimes when we're lying on the floor, you can actually feel the weight of your head on those bones, right? They almost create like a little bit of a resting point on the ground for you. Okay. So that's all around this area. All of these bones together that make up the spinal column are called vertebrae. All right? We're going to look at the spine in some more detail in a second. We're going to look at the different areas of the spine, and we're going to take a look at the individual sections that make up the vertebrae as well, because they all have different functions and shapes based on where they are. Okay. On the back here, we have these scapula, which are oftentimes in layman's terms called shoulder blades. So we've got one on the left, we've got one on the right, and they basically sit on the rib cage. So our ribs attach onto the spine. We have 12 sets of ribs. We have a set on the right and we have a set on the left. And basically, they create this protective cage for the internal organs. what internal organs live inside this rib cage? Lungs and the heart, exactly right. So the lungs and the heart are quite well protected. More so than perhaps some of the other internal organs that are below it, right? Because there's no bones on the front of the body here by the belly. Okay, so now if we take a look at the scapula, do you notice that there's this ridge along the top here? This is called the spine of the scapula, up at the top. This is called the tip of the scapula, down at the bottom. And then, oops, this little edge on the inside is called the medial border, right? Medial towards the midline. So that's the medial border. Which border is this? Lateral border. You've got the medial border and the lateral border of the scapula. And notice how this little top area, the spine, actually curves around and attaches at the front. So I just want you to put your fingers on your shoulder for a second and just feel around to the front, and then can you feel that there's like a little groove, a little joint? It's kind of towards the front here. Can you feel that? Okay? That is this little connecting point right here. Okay. So this little hook is called the acromion process. When you hear the word process, it tells you that there's going to be a muscle that attaches there, right? Then this little acromion process is touching, it's connecting to this bone at the front, which we call the clavicle. A lot of people call it the collarbone, right? So I just want you to trace your collarbone, one or both of them. So it goes almost horizontal, yeah, to the ground, yeah?
Feels like it's two bones, it's actually one.
It's one bone, it's one bone. I think you might be too high up, so you've got to be a little bit lower down. Yes, there,
Okay,
at the front, you've got it. So now, if you trace your collarbone outwards, and you get to that little groove, that is this joint here. And now, trace your collarbones back towards the middle, and then can you feel that you get to another little groove here on either side? That is where your collarbone, your clavicle, now connects to what is called your sternum. And again, a lot of people call this the breastbone. This is the sternum right here. And so if you put your fingers up at the top of the sternum, this is called the sternal notch. Okay, it's like a little notch that you can put your finger into. Trace your fingers down your breastbone, down your sternum, all the way to the very bottom. Now don't push too hard because it's like a little vomit area. It'll make you feel a little bit sick if you push it too hard. Can you feel that there's this little tip that's right down at the bottom here? That's called your xiphoid process. It's spelled really weird. It's an XIPHOID. That's your xiphoid process. Guys, when you hear the word process, what does it mean?
Muscles are connected.
Absolutely. There's some kind of attachment of muscles there. And the abdominal muscles are going to be connecting there. So when we talk about the muscles later, we'll be talking about that. Okay. So now you noticed as well how your ribs came around from the back where they attached to the vertebra. They're curving all the way around and they connect at the front to the sternum. Not all of them connect directly and some of them don't connect at all. Check these two little ribs at the back. These two bottom ribs at the back are called floating ribs because they literally don't connect to anything. They're floating in space. Okay? The next three ribs, 1, 2, 3, look how they all share the same piece of cartilage. Okay? That connects to the sternum. So those three are called false ribs. because they're actually all sharing the same connection. And then the next ribs are called true ribs. Okay? Look how high up the first rib is. So if you put your fingers back on your collarbones and then go over the top. Now don't dig in too hard because you've got a lot of nerves that are under there. Your first rib is above there. When we feel our ribs, don't we all naturally do this? So we kind of think of, okay, ribs are down here. Your very first rib is above this collarbone. This is huge. Okay, gives you an idea of how big your lungs are and hopefully how big our hearts are. Okay? All right. Any questions so far, guys? Making sense?
Yeah.
All right. So if we trace our way back to the shoulder joints, we've got the clavicle that connects with the acromion process, which is part of the scapula. That makes the top part of this shoulder joint. The other part of the shoulder would be this bone here. And this bone is called the humerus. Okay? So it sits inside that shoulder socket and it gives us flexion, extension, abduction, adduction, and rotation. You guys remember all those movements? Okay. So this is the humerus. And then when we come down to the forearm, this is the elbow. And below the elbow, we have two bones. This bone that is closest to the thumb is called the radius. And this bone that is closest to the baby finger is called the ulna. The radius and the ulna. Now, this relates back to what Caitlin was asking about earlier. This is very unique because without even involving the elbow, I can rotate the shoulder. Okay, you were talking about screwing in a light bulb, which you can do if you kind of like have to really reach. But I can keep my shoulder still, and I can do this movement, which is called pronation. So it is a very specific movement where the radius rolls over the ulna. And we can pronate and supinate our forearm. Yeah? Okay. So that's the radius and that's the ulna. Guys, this is going to be relevant when we start doing some movement practice tomorrow. Do you see how thick the bottom of the radius is in relation to the ulna? The radius is your weight-bearing bone. So when you set up for things like downward facing dog, upward facing dog, 4-point kneeling, plank pose, you have to make sure that you're weight-bearing correctly on your wrist to avoid injuries. Okay, so we're going to talk about that tomorrow when we start applying this to some movement. Okay, we might even do it tonight so you can feel it. So now we come down to the wrist, and we have these 8 tiny, unique little bones in our hands, which are called carpals. You don't have to memorize the names of those 8 bones, okay? You just need to know that they have these irregular bones here. And then we have metacarpals, which run through the palms of the hand. And then our fingers are called phalanges. Strange name, okay? Phalanges, exactly. Okay. So this is our upper limb. Humerus, radius, ulna, carpals, metacarpals, phalanges. All good?
Yeah.
So, check out this correlation here. We're going to talk about the pelvis in a second. This bone, it's bigger than this bone, but can you see that it's a very comparable shape? Okay? This bone is called the femur. Yeah? The femur can flex and extend, abduct and adduct, and rotate. Do you see any similarities between these two joints?
Yes.
Okay. So these joints here are called ball and socket joints. It looks like a ball sitting inside a socket, right?
Yeah.
Okay. The major difference is, look how deep this socket is. This is very, very stable and solid. It is super difficult to dislocate again, like really difficult. Okay? This is very, very stable and it's designed for weight bearing, walking, etc. This has so much more range of movement because it is so shallow. Okay? It's still a ball and socket joint, but it's much more vulnerable. Think about the number of people you've probably heard of or you know that have dislocated their shoulder. Yeah? So, with this increased range, this increased mobility comes less stability. With more stability comes less mobility. I can take my arm right up next to my ear. You could be the prima ballerina in the world, and I promise you, you're not actually just bringing your leg right up. It has a different range of movements, and it's got different levels of stability. Okay, so you see the similarities between the joints and the top bones. This is called your femur. Below that, in your lower leg, we now have two bones. How many bones do we have up here? Two. How many bones down here? You see the similarities, right? Okay. This thick bone is called the tibia. And this thin, delicate bone on the side is called the fibula. So oftentimes you might hear people call it the tib fin. All right? This is your tib fin. So the tibia is much thicker. It's designed for weight bearing. Similar, for example, to the radius. It's a little bit thicker at the bottom. This is designed for the weight bearing. Then we come down to the actual joint and the feet. So again, you see the strange shapes of these bones here. These are called tarsals. In the hand, they were called carpals. In the feet, they're called tarsals. And then we have metatarsals. And then these little end bits are called phalanges. You've got phalanges on your hands and phalanges on your feet. Okay? We just happen to call them fingers and toes. So you see all the similarities here. Yeah? If we take a look at the knee, what is a bit unique here is that we have another bone here called the patella. So in layman's terms, we call it the kneecap, right? Most of our clients will know kneecap. Not everybody knows patella. What's super interesting as well is it is again a floating bone. It's actually embedded in the tendon of your quadriceps. So just sit comfortably for a second. Just have your legs out in front of you. Just let your legs go nice and floppy. And then I just want you to take your fingers and just wiggle your kneecap around. Didn't you ever used to do that when you were a kid? Yeah? So it's moving around inside the fascia, the connective tissue of the quadriceps muscle. And you can move it side to side. So this is one of the reasons why some people have some serious knee issues. If you have any kind of overdevelopment of one part of the quadriceps, it can start to pull the kneecap out of alignment. If you have a weakness on any particular part, it can also allow the kneecap to get pulled out of place. So it is quite important to make sure that you have that symmetry, that
equal work happening through the quadriceps, and that's going to help the kneecap as well. And flexibility. Okay. So now let's go back to just comparing the arms and the legs, because now we're talking a little bit about the joints. So let me just go to our screen share. And we've just jumped to this section right here where we're talking about the joints. So guys, we have different kinds of joints through the body that, along with the bones and where they are, they're going to allow us to move in different ways. All right, so we're going to talk about some of these bones now. So we just actually spoke about the shoulder and the hips, which are what type of joint? What does it look like? Ball and socket, absolutely. That's exactly what it looks like, right? If we go down from the ball and socket here to the next joint below, which is the elbow and the knee, we call these hinge joints, because it's like the hinge of a door. It pretty much only moves in one direction. If it does start to move in other directions, it's actually a problem. Okay? So, and that's how people can injure all of the ligaments and the muscles around the knee, around the elbow, because they put some kind of weird strain or movement onto those joints. Okay? So, we've got a ball and socket, which has got a lot of mobility, followed by a hinge joint, which has less mobility. It can only go forwards and backwards. It can only do flexion and extension. And then we come down to where the wrists and the feet are, the hands and the feet, and we have all of these unique kind of weird joints. These joints are called gliding joints. They don't move in just one direction. They can slip and slide and glide, which is fabulous, because when we're standing, we kind of need our feet to kind of spread out under us like pancakes to hold our weight. Same thing when we're using our hands, or maybe when we're on our hands in a 4-point kneeling position, we're weight bearing, and they will distribute the weight evenly as much as possible. Yeah? Okay. So, similarities between the upper body and the lower body and the different joints that we have there. We have some unique joints in the body as well. And one of them is called a saddle joint. It looks like a horse's saddle. Okay? The saddle joint is very specifically found at the base of the thumb. And it is unique to humans, and it's given us a big advantage over other primates because it gives us fully opposable thumbs. So when you start doing your vinyasa with Bianca, you're going to do different hand positions, which are called mudras. Yeah, you've heard of these? Yeah, okay. You're going to be doing different hand positions that connect our energies in a different way. So what I'd like you to try is if you bring your thumb and index finger together. Can everybody do that? Fabulous. Chimps can do that too, by the way. But now, can you bring your thumb and middle finger together? Chimps can't do this. Can you bring your thumb and ring finger together? Chimps can't do that. Now bring your thumb and baby finger together. Chimps can't do that. We have fully opposable thumbs, which has been a massive advantage for us. Okay, and that's all due to the saddle joint at the base of the thumb here. So that's one of the joints. We also have some very specific joints in our fingers called condyloid joints. So that when we do something like bye-bye, little kids waving bye-bye, okay, they can do this, and they can open and close as well. Okay, so they can move in a couple of different axes,
The only thing they can't do is rotate. Yeah? And then somebody and everybody thinks, but hold on a second, I can do this. Okay? This movement, I've got so the camera so everybody can see, this movement is different from twisting. This movement is called circumduction. Yeah? The circumduction, exactly. So please come up and standing for a second. And if you can imagine that we're at like a warehouse party, we haven't done for like 20 years, okay? All the lights are out and you've got these like little neon glowing sticks, all right? So if you stand in anatomical position, I want you to flex your right shoulder. I'm going to do a mirror image for you. Flex your right shoulder, hold it there, and we are going to suspend a little glowing ball in the air there. That was flexion, yeah? Come back to anatomical position. Now adduct your right shoulder. And you're going to leave a little glowing ball there. So you've got one in the front and one at the side, yeah? Okay, leave them there. Extend your right shoulder. You're going to leave a little glowing ball behind you. You've got 1, 2, 3. Everybody with me? And release. And now adduct your right shoulder and leave a little glowing ball right here beside you. So you've got 1, 2, 3, 4. We're going to play join the dots. Okay? Here we go. Flexion, abduction, extension, adduction. Flexion, abduction, extension, adduction. Smooth it out. Flexion, adduction, extension, adduction. Have I said rotation once?
No.
There is no rotation involved in this movement. We're making a circle shape, a cone shape. I can do that with my shoulder. I can do that with my finger. I can do that with my hip. That is called circumduction. It's different from rotation. Okay, makes sense? Fantastic, grab a seat. And then we have a few other specialized joints. Beautiful little white one, hey? Oh, beautiful. I'm trying to make it right side. So, we also have joints called pivot joints. So remember we were talking about the forearm being able to pronate and supinate. That is because we have this little round pivot joint up at the top of this radius bone that can rotate and rotate. The pivot joint rotates and allows these very specific movements at the forearm. Okay, so it's another joint that we've got is that pivot joint. And then we have another joint which is actually right up at the base of the skull. This is basically where your skull sits on top of your spine, and it's called an ellipsoid joint. Okay, so an ellipsoid isn't quite round, it's a little bit more egg-shaped. So it's a slightly different function. And that's where the skull sits on top, and it is called the atlas axis. And all it can do is allow a little bit of rotation, slipping, and sliding movement. And then you might be thinking, hold on a second, I can do lateral flexion, I can do flexion, extension, I can do rotation, but in fact, that is coming from the next vertebra down. Right where the skull is sitting on that very top vertebra doesn't have that capacity. That ellipsoid joint is just allowing your head to balance there and do very small, subtle movements. Okay? Is everyone okay so far? Yeah.
Fantastic. Good. Practicing your perfect. So what I'd like you to do just for a moment is to come and kneel on all fours. Just get your wrists in a comfortable position. Get your knees into a comfortable position as well. And find a little bit of length through your spine. And then I just want you to close your eyes for a moment and notice your body weight on your wrists, hands, and fingertips. And in an ideal world, we want to have 60 to 70% of our body weight on our thumb and forefinger, because that's where the radius, the thick bone of the forearm ends. So do you need to move your hands wider? Do you need to turn your hands in or out a little bit? Do you need to spread your fingers slightly? Feel it out. And then when you're ready, you can open your eyes. So the point is, we talk about the setup of the wrist, but it's not ideal for everyone. Everybody's slightly different. Give people permission to figure out where they need to find their placement. Now, in this position, can you roll your shoulders up towards your ears and neck? Roll them forward. So that is internal rotation, and you can feel how your scapula are elevating, your hunching. Now roll the tops of your shoulders backwards in the socket and keep your spine lengthened. Roll them back. And again, roll your shoulders internally. And then roll your shoulders back. That's it. Be careful that you don't drop through the midline. Yes, hold it there. So with this external shoulder rotation, can you keep a gentle connection into your thumb and forefinger? So you're actually doing pronation of the forearm right now. Crazy, hey? Wonderful. Now, can you allow your chest to sink a little bit towards the ground? Keep your elbows straight. Feel how the scapula squeeze together. And then press away from your hand. So as you push away from your hands, you can feel the scapula glide wide apart. And again, allowing your shoulder blades to squeeze together. And then press away and feel them move apart. Let's just do one more time. As you let your chest sink down, this is called retraction of the scapula. Now press away from your hands, and that is called protraction. And now let your scapula settle in the middle in a neutral position and hold. Is everyone okay still? Tuck your toes under. I want you to hover your knees just off the ground and feel the weight bearing on your upper body. Your scapula are stable. You have external rotation of the shoulder. You have pronation of the forearm, so you are weight bearing on thumb and forefinger. And on your next breath, send your hips up and back and come into your downward facing dog. Pedal out the heels if you need. And then reach your heels to the ground. It doesn't matter if they touch or not. It doesn't matter if your knees are bent or not. I want you to roll the tops of your shoulders backwards in your socket. Relax the back of your neck. Your scapula are glued to your ribs. Your thumb and forefinger are connected to the ground. That is your setup for your downward facing dog. Take a breath in. Exhale. Lower your knees all the way to the ground. Let yourself sit back into your resting position
and just take a moment to breathe and take the weight off your wrists and hands. Really nicely done, guys. I'm just going to take another inhale. And on your breath out, just walk yourself all the way back up and lift and tall. Fantastic. How was that? Felt okay? Yeah. Could you feel that whole set up of the upper body? Yeah? So, you know, it's one of the things that I also try to really emphasize to people is that it's so easy for us to fall into the trap of we kind of know what the ideal setup should be. Wrists below shoulders, middle finger forward, spread the fingers out, you know, and up you go into your position or whatever position you're going into. It doesn't necessarily work for everyone. Some people might have a very difficult time pronating, and then all of a sudden they're rolling to their baby finger and their thumbs are lifting up. That's a wrist injury kind of waiting to happen, right? Why don't they take their hands wider? And it's almost like they feel like, well, nobody told them that they could, or everybody else beside them is in that position, so they kind of force it. Let them move, you know? Somebody might be really tight through the neck and shoulders. Maybe they need to take their hands wider apart or even maybe a little bit more forward. So people need to kind of figure out how to explore that. And that's as well as we go through all of this work over this weekend of being able to apply that knowledge to the practical stuff that you guys are doing as well. Make sense?
Yes.
Fantastic. All right, good. So now what I'm going to do is backtrack a little bit here on your PowerPoint to talk a little bit about the bones themselves, okay? So this is in your outline, and the bones themselves, we have as human adults 206 bones in the human body. Babies, when they're born, have about 300. Yeah, so what happens to them? So one example is that when babies are born, the head is not solid, because if it was solid, I promise you, I don't know any woman that would actually be able to push baby out. All right? We have 8 different plates that make up the skull. And when baby is born, those plates are not joined together in a solid way. So that when baby is pushed out, the head can basically mold into like a little bit of a cone shape. So baby comes out with this cone head, and we think they're absolutely gorgeous anyway, right? But let's face it, they all have this funny shaped head. And there's like a little bit of a soft spot on the top, which is why you never want to actually push directly on top of the baby's head. And then over a matter of months, those plates actually suture and knit together, all right? And so it's now considered one bone. It was 8 and now it's 1. Okay, so that's just one example of how the bones start to integrate, so that as we go from a baby to the adult human, then we end up with 206 bones. This also brings us back to a little bit of information about the joints, because we have different types of joints in the body. These little sutures on the skull are actually considered a joint. Yeah? But it doesn't want to move, all right? It's quite a rigid joint right there. There is not a lot of movement around it. However, if we take a look at the pelvis, and we haven't spoken about the pelvis yet on our skeleton here, we have 2 halves that make up the pelvis. We kind of talk about the pelvis like it's one big bone, but in fact we have a right half and we have a left half of the pelvis. And at the front of the pelvis, do you see this rubbery bit right here? Okay? That is also a joint. It's called a cartilaginous joint because it's like cartilage, it's quite rubbery right here. It allows a tiny little bit of movement that we need for us to be able to walk, that we actually need to have it soften in order to push baby out the birth canal. Okay? If it was completely rigid at the pubic bone and locked, we'd be walking like that, right? We wouldn't have the necessary movement to be able to move around freely. Okay. So that is a cartilaginous joint. This is an immovable joint. All the other joints that we spoke about earlier today, ball and socket, hinge, pivot, okay, all of these gliding joints, the condyloid joint, those are called synovial joints. Synovial joints have this lining of fluid called synovial fluid that acts as a lubricant and allows it to glide freely. Okay, so these are some different types of joints that we have through the body as well. So if we go back to look at the pelvis, we have the right and the left halves, and this big section on either side is called the ilium. Okay, this is the ilium right here. Now, if you guys don't mind just sitting for a second, I want you to just place your hands on the sides of your pelvis, on the top here, and where you are resting your hands right now is called the crest. That is your iliac crest. Now start to slide the tips of your fingers down and forward just onto the front of your pelvis there. Can you feel those two little bony points right there? So that is called the ASIS. It's a bit of a mouthful. You've got one on the right, you've got one on the left, and we use them as landmarks a lot of time. So if you think about your warrior, and we might be looking at the ASIS shining straight forward. It stands for anterior, superior, iliac spine. ASIS. Anterior, superior, iliac spine. Okay? So those are those little bony points at the front. Now, put your hands back onto your iliac crest. And I want you to start tracing your thumbs down the back. Isn't it a tender? Can you feel that there are two little bony points at the back there as well? That's called the PSIS. That is your posterior superior iliac spine. And again, it gives us reference about our pelvic position and placement, the direction that the pelvis is facing. That's the PSIS. Now, if you lean forward just a little bit and slide your fingers just a fraction lower, that can be quite tender for some people. Yeah? Yeah? That is called your sacroiliac joint. Oftentimes it's abbreviated SIJ. So your sacroiliac joint is basically where your pelvis connects to your sacrum part of the spine. And these can be quite vulnerable joints, especially on women, because the shape of our pelvis is different. And especially if you have had kids before, this oftentimes softens and releases in order to be able to go through pregnancy and then also push baby out. And if we don't recover the muscle tone and the muscle strength around the pelvis, this can be quite a vulnerable area for a lot of people. So mostly women, but men can also have issues if, for example, their bum cheeks aren't doing what they need to do. Okay? Have you guys heard the little saying nowadays that sitting is the new smoking? Yes. Sitting is the new smoking. It is the new bad habit that everybody's gotten into. Because so many people, as part of their jobs, as part of their entertainment, as part of their lifestyle, are seated for extended periods of time. The bum cheeks switch off, and then we lose all of the power and the strength around the pelvis, which is why doing things like yoga is so fantastic. Yeah? Starts to find all of that strength around the pelvis again. Okay. So, you guys happy with the different types of joints that we've got? Okay? Immovable, cartilaginous, synovial joints. So now, the bones, we have 206 of them in the human body. We just did a little bit of a walkthrough of the human skeleton, and you guys seem to be pretty good with all of it. There's one more that I want to point out to you before I forget, and that is these bones on the bum. So right now, as you guys are sitting there, can you feel like you've got some weight on those bones? We call them the sit bones, right? Because you're sitting on them. The clinical name for them is the ischial tuberosity. Why do you think they have holes in them? Why do you think there's a hole in that pelvis right there? So just tell you. So, if that was a solid bone, you can first of all imagine how heavy it would be, right? This also provides a place for arteries, nerves to run through. Exactly. And it's fabulous for shock absorption. So that every time you sit down, you always have like a little bit of a bounciness that can actually bear your body weight through those bones as well. So that's why we have those bones there. Okay. So your sit bones are actually called your ischial tuberosities. All right. Okay. So the bones themselves, we've got lots of different shapes of bones. You don't have to memorize all of them. But for example, we have long bones like the humerus and the femur. We have floating bones like the patella and the hyoid, and those are called sesamoid bones because they're floating. Yeah. We have flat bones. All right. We have irregularly shaped bones like these ones in the hands and in the feet, the carpals and the tarsals. So the bones themselves on the outside look pretty hard, yeah? That outer shell of the bone is called compact bone. But on the inside is actually almost like a honeycomb, all right? It's called trabecula. So the inside of the bones are actually much lighter, okay? So birds have very little compact, heavy bone. They've got lots of light bone, which is why they're able to fly. Okay, there's no matter how hard we flap, our bones are simply too heavy to be able to get us airborne like that. So we've got compact bone on the outside, and then we have trabecula on the inside. On the outside of our bones, we have this sort of shiny surface called periosteum. Remember we spoke about it earlier when we were talking about the meninges, yeah? So periosteum is this shiny coat. Are you guys vegetarians? Have you seen raw chicken before?
Yeah.
Okay. So if you take raw chicken and you peel it away from the bone, you know that you've got that drumstick, and it's quite a shiny surface. That's periosteum. And we have the same thing around all of our bones as well. Okay. On the insides of certain bones, we have the capacity to store something called marrow. Yeah, exactly. So when we're babies, we can actually have marrow in all our bones, and I'll explain why in a second. As adults, it's only in the long bones of our body, like the humerus and like the femur. All right? Now you can get something called yellow marrow, which is pretty much fatty tissue. So guys, a fancy word for fat is adipose. Okay? So basically they talk about adipose, and it's one of the ways that we actually can store energy in our bodies. It's fatty stores in our bodies. But then we also have red marrow, and that red marrow has the capacity to create blood cells. Yeah? So now that also explains why a tiny little baby, all their bones have the capacity to create blood cells, because as they grow, they need more blood. They need to fill their body with more blood. As they grow bigger, they need more blood. It's only when they reach full size that we don't need to create that massive amount of blood anymore. Yeah? So that's why then that capacity is only limited to the long bones right here. Makes sense? All right. The bones are quite an amazing thing as well, yeah? Okay. So I think what we're going to do, because I think I've given you a lot of information, yes? All amazing things about the human body. So I want to actually share with you, we're going to only talk about the spine tomorrow. Are you guys happy with that?
Yeah.
I'm going to share with you just a little video. So we'll record. I'm going to do a little screen share here so that you guys will have access to it. So this is Thomas Myers, and he's absolutely a fantastic presenter, very dynamic. You guys all see?
Yeah.
Okay, so fascia is a perfectly good medical term that has been incorporated, neologized, brought into a different meaning. The medical meaning for fascia is certain sheets of biological fabric inside the body. So we talk about plantar fascia. Plantar fasciitis is actually the plantar aponeurosis. We talk about the thoracolumbar fascia. It's actually the thoracolumbar aponeurosis and other things. We needed a word that would describe the whole net. Your body is held together by a net. If you're 65% water, depending on how fat you are, you're somewhere near 60-65% water, and how old you are. And why doesn't that water just end up as a puddle at your feet? You know, why don't you just have great big balloon legs? Because the fascia, because the biological fabric of the body, which is not dissimilar to the plastic in a plastic carrier bag that you bring your groceries home in, that fascia organizes the water into cells, organizes the cells into groups of cells called fascicles because they're surrounded by fascia, and organizes that into a bag that you might call a muscle, and organizes that inside a bag. It's bags within bags within bags within bags all the way down to the cellular level. You can just think of an orange. An orange is an easy way to think about that. Each drop of juice is contained within one of those little cells. Those cells are contained within the section is contained within the rind of the whole orange. It's the same for a human being. You have small droplets of water, gel, but very watery gel, combined in a membrane, combined in a bigger membrane, combined in a bigger membrane, combined in the membrane of the whole body. So we really haven't had a word for that whole web work. We haven't had a word for that whole network. So fascia has been incorporated as a term for that whole webbing, the soft tissue webbing of the body. Now, in fact, that same kind of webbing goes right through your bones, and it goes right through all the cartilage that's at the end of the bones on your joints, the cartilage that's right in here, and the cartilage that's in between your vertebrae and all of that. That web work goes through all of it. It's very much like leather, like your belt or your shoes. That kind of thing is the fascia inside a bone, but then the bone has been impregnated with calcium salts, so it has that solidity. So you can either pull on a bone or push on a bone, and it will resist either one of those forces. Tendons, if you push on it, it's going to collapse, but it's great for tension. So tendon, in the new use of the word fascia, tendon is part of the fascia. All of the fascia that goes around the muscles and within the muscles and through the muscles and around the organs and through the organs and in between everything, it's all this network. And the only reason that it's new, it's not a new tissue. You've been dealing with, if you're a trainer, you've been training fascia since you started training. If you're a body worker, you've been working with fascia since you put your hands on the body. You can't avoid it. It's right under the skin here. So you're going to come in contact with it. The only thing that's new, what's new is we're considering it as a system. We've thought about the plantar fascia, we've thought about the Achilles tendon, you can think about the central tendon of the diaphragm, you can think about the nuchal ligament. All of these are simply zip codes, or postcodes for those of you outside the United States. These are areas, but they have no separation. It's really important that you understand this. The science is that there is no separation between these things. We have made the separation. We came along with a scalpel. We cut out the plantar fascia and said, see, plantar fascia. We cut out the biceps and said, see, it's a muscle called the biceps. But when in the action of cutting that muscle out, we cut it away from all the connections that it has. My work, the anatomy trains, is that the biceps has a connection up and down the arm. It goes up from there into the pectoralis minor and down from there to the thumb. There are specific connections from the biceps, north and south. There are also connections from the biceps, east and west. It connects to the brachialis. It connects even over the intermuscular septum into the triceps fascia. When you are doing your preacher curl, you may be training the muscle of the biceps, but you're training all kinds of fascia around it. You're training the fascia.
Yeah?
Is it done?
Oh, that's just like a little snippet. Cool. All right, so that's Thomas Myers. So guys, he's got a lot of stuff that is accessible online. He's got a lot of stuff on YouTube, so definitely worthwhile checking it out, having a little bit of a deeper look as well, but I'll keep referring back to this as we go tomorrow as well. Okay. How are your brains?
That's a bit emotional.
We there, it's all stored there.
Yeah. So you'll be sending us this video.
Absolutely. Okay. So guys, don't worry to even review anything tonight. Just let yourself, like you said, it's all gonna sit there. You don't have to go off and read anything tonight or review anything. We'll pick up again tomorrow. I'll see if I can keep reinforcing everything that we've gone through today as we go through tomorrow as well. And then we will have plenty of time to review after that. All right. Awesome. Well done. Absolute pleasure. So guys, we're going to be working in here again tomorrow. Zara's going to be hopefully joining us, so we'll just make space for her as well. So you're welcome to leave anything here that you need. You don't have to pack away mats or bolsters or anything. I'm going to leave all of this here so that we can just come straight back in tomorrow. And what time are you guys keen to start tomorrow? 9, 9:30?
9:30, I don't know.
9:30, I don't mind.
Okay, so let's do 9:30 tomorrow. I'll send you a WhatsApp. Yeah, exactly. And I'll send you a WhatsApp to the group tomorrow. Feel free to bring along your lunch. As you saw, there's coffee and tea here, water as well. Bring along anything else that you want, because we'll have probably 2 breaks tomorrow. Okay. Great. Fabulous, guys. Thank you.